I would start by saying that there are clear national guidelines that every woman with ovarian cancer should have genetic testing. And we've only been doing so-so on that. So throughout the country, probably less than half of all women with ovarian cancer get the genetic testing. So they really need to do that. Having said that, there are a lot of women just like you whose moms or whose aunts may have had ovarian cancer, and in those situations they don't have cancer, and the question is, should I have genetic testing? And what I would say is that it's really, for someone who has a family history of ovarian cancer or who has breast cancer in their family, you're already thinking about it. You're already thinking, you know, I may have this increased risk. And now genetic testing is accessible, it's much more affordable, and it's really something that you should consider. You know, the way I put it is that you know, based on your family history, that you are at increased risk, and by doing the genetic testing, it helps to kind of turn on the lights in some ways, and allow you to, if you are at increased risk, to do take preventive measures to decrease that risk. So it's powerful to know. It's powerful information.
For sure. And related to that, we have seen a lot about this MAGENTA study that's going on. And tell us about its benefits and what should the women and the families know about this program? What is this project? Why would they be interested in signing up for it? So anything that you would like to share.
Yeah, so MAGENTA stands for Making Genetic Testing More Accessible. And one of the things that we realized was that, you know, if you have access to, you know, good health care, you're in a large city, that's lucky for you, but we wanted to make sure that women throughout the country, even in rural areas or in areas that are not so close to kind of, you know,
accessible
to these services, that you would have access to it. And so this is a study that's funded by Stand Up to Cancer, and what it is it's testing this concept. We call it genetic testing from your living room.
That's great.
Yeah, and so really what you do is you can just search MAGENTA and genetic testing, or MAGENTA and MD Anderson, and there's a website, there's a nice video that kind of explains the purpose of this study. What we're trying to do is really understand what's the best way to make sure, one, that it's accessible to all women who have a family history, and two, what's the best way to deliver it? Is it better to send you information through the internet? Is it better to have a genetic counselor that talks to you on the phone beforehand? And then once you sign the consent form and you fill out questionnaires, you get a spit kit that's sent to you, and it explains how you kind of essentially spit into a little cup and send it back, and then the results are available in about 6 weeks or so. Okay. And so the whole process is delivered through either the phone or through the internet, and you can already get this type of genetic testing, but what's important is that we study that it's safe and that we're not causing harm, and that it's easy, and so we have accrued about 500 women so far in a very short amount of time, and we're looking to accrue about 3,000 women across the United States. Unfortunately, it's not open in New York right now, but it's open in the other 49 states.
So these women that you're looking for, are they ovarian cancer patients, or are they co-survivors, daughters?
It's a great question.
Who is this target population?
So it's not for patients who have ovarian cancer, because they should be getting the testing anyway with their doctor. It's really for daughters and
extended family members
and extended family members.
Okay. Yeah. And that's great to know, because, you know, when you are removed from the disease, ease becomes a very important factor, right? Because if this is so easy, where you can just do it from your living room and send out the kit, and then the results come back to you, then, you know, you get all the benefits without having to work for it, really. So, and it doesn't sound intrusive in the sense it's not a needle, it's not a prick, it's nothing. I mean, it's just a spit. So that's great. I mean, and so by the end of this year, or what is the time frame for?
So it'll probably be open. We want to accrue up to 3,000 women, so it'll probably be open for at least another year.
Okay.
So
that's fantastic.
Thank
and
you.
So we wish you all the best with this study, and we at Ovarcome will make sure that we can send more information out to our audience. So if there are any questions about the study that you would like to ask Dr. Liu or us, please feel free to send us your questions. We'll make sure that we get it to Dr. Liu. And then in terms of just overall prevention, overall just watching out for this. We know that it is not a very easy cancer to watch out for, and then there are no vaccinations available or screening available for, which makes ovarian cancer a difficult diagnosis, and also for people like us who have family history but are not carriers but still want to be watchful. Is there any particular kind of guidance or surveillance that you would recommend for family members?
So what I would say is that when I talk to women, I always say, let's estimate your risk of ovarian cancer, and then we can kind of personalize what our recommendations are for prevention. Mm-hmm. So clearly, high-risk women who have a gene mutation, we want them to be thinking about ultimately, removing ovaries and fallopian tubes. Mm-hmm. We actually have a nationwide study looking at doing it in a two-phased approach where we take the fallopian tubes out first, and that's taking advantage of the information that we've learned that it may start in the fallopian tubes, but we don't know if it's safe, so we need to study it. And that study is called WISP, W-I-S-P. For women who may not be at that highest risk, there's still things that you can do. We know that the oral contraceptive decreases ovarian cancer risk by 50%. That's a lot.
That's significant.
It is really significant, and it's something that that women should know. And I think that just knowing your body and understanding that if something changes, that you start having symptoms that are unusual for you, we usually say if it's more than 2 weeks, we want you to talk to your doctor.
Okay, that's great.